Ontario is known for its high quality of healthcare services. And Ontario physicians, you do your best to communicate well with your patients, pay attention to their needs, and do what it takes to provide quality care. As a result, receiving a call from the college regarding a patient complaint can be an extremely stressful and frankly confusing process for many physicians, regardless of their level of knowledge, expertise, or years of practice. The Patient and Public Health Center receives over 50,000 calls each year, some of which can result in a complaint against the physician. Often, complaints are based on simple issues which can be resolved without a formal investigation through a mediated discussion with the patient. This process is called alternative dispute resolution. The majority of complaints are related to issues such as communication, physician conduct and behavior, access and transfer of records, and consent. Let's look at some simple ways in which you can address these issues proactively and lessen your chance of receiving a patient complaint. First, always practice good communication. The impression made in just one short visit can affect the patient's future interactions with you and other healthcare providers positively or negatively. Simple techniques like making eye contact, listening and nodding, encouraging the patient to describe their symptoms in their own words are all important ways to connect. Addressing the patient respectfully by their name can make a huge difference in the patient's experience. Allowing the patient time to make their concerns heard is important. Second, keep medical records accurate, sufficiently detailed, and up to date. Good medical records, whether electronic or handwritten, are essential for the continuity of care of your patients. They provide the basis for current investigations and treatments and allow subsequent caregivers to understand the patient's medical condition. They also provide other healthcare professionals in the patient's circle of care with a clear picture of the patient's health. Good medical records and notes help patients feel assured that their health is a top priority. Third, obtain appropriate consent. Fourth, maintain appropriate boundaries. In general, here are some common behaviors to avoid. Acceptance of gifts from patients or their family members, excessive self-disclosure to the patient, according special treatment to the patient, romantic thoughts or feelings about a patient, secrecy about aspects of the doctor-patient relationship, arranging social encounters outside of work or clinical visits, interacting with the patient through social media or using personal profile, language with sexual connotations. The bottom line is, the best way to avoid a complaint is to practice professional behavior. When in doubt, consider these 3 questions. What would most doctors do in this situation? What is the CPSO policy or position? What would an ethical doctor do? The practice guide and CPSO policies are designed to help physicians make wise decisions related to their practice and provide guidance to facilitate an environment of quality patient care. Visit the CPSO website for the most up-to-date information. If you have a question or are unsure about any aspect of your practice, do reach out to the Physician Advisory Service. One of our skilled advisors will be happy to answer your questions and direct you to the appropriate resources.